my name is Nicole Kaufman. I'm a nursing student at Bellarmine University. I'm going to be describing what an enema is and then how to administer one. So an enema is the administration of a liquid substance into the rectum to aid bowel evacuation or to administer medications. It is typically used to relieve constipation, but also to expel flatus, empty bowels before a diagnostic procedure, or instilling a medication. So there are two different types of enemas for bowel evacuation, although they are very similar. So you have an immediate enema, and this lubricates and thus facilitates the passage of the feces. It can also increase peristaltic contraction of the rectal walls. And then you have retention enemas, and it has basically the same effect as an immediate enema, but it remains in the rectum for a longer period of time, penetrating and thus lubricating the feces even further. And this tends to be oil-based. So there are several precautions to take with the administration of an enema. One would be to avoid the use of them with a colon surgery patient or with a patient who has had any obstruction or injury. And this is because it increases the risk for perforation, which is the creation of a hole in the patient's GI tract. The risks are considered low, but it can be detrimental and, of course, sometimes fatal. So with the procedure, you'll, of course, need your PPE, so you'll need gloves, you'll need a disposable gown, you'll need chucks, a lubricant, a bedpan or commode, a saline solution, or your other prepared enema solution that you might have. So first you'll want to obtain consent from the patient to do this procedure, and then you'll identify any allergies or past medical history of the patient. Then you'll want to provide for privacy, so close the door, close any curtains that might be in the room or on the windows. You'll wash your hands and then don your PPE. You'll want to make sure the enema is not expired and that it is still intact before you use it. Some enemas you'll want to warm before you use to the body temperature of the patient, and this just could be beneficial because it heats the enema solution, stimulating the rectal mucosa. Cold solutions should never be used because they will cause the patient to cramp, and this is kind of opposite of what we want to do with an enema. The ones we have in this video, you don't have to heat, they're at room temperature. When you give an enema, the best position for the patient to be in is on the left side in the Sims position with their right knee flexed. This position will help ease the passage of the fluid, and it allows the solution to flow downward by gravity along the curve of the sigmoid colon and rectum. The patient can also be in the knee-chest position where the patient kneels, then lowers the head and chest forward until the left side of the face is resting on the bed, and then their left arm is folded underneath their abdomen. And this is not the ideal position for most patients because it's very difficult, especially if you've just had surgery or for older patients. Sometimes it will also help your patient if they bear down like they're trying to have a bowel movement because this relaxes the muscles around the anus. Of course, you'll want to place the chuck underneath the patient before you give the enema. And then you'll want to be very informative throughout the whole procedure, giving them information about when you're doing something, what you're about to do, and what's going to happen, because this is a very private part of the body. You want to assess for any hemorrhoids or skin breakdown, and then instruct the patient to take deep breaths. So this is my patient, but he's not going to be very cooperative, are you, Troy? Say hi. I'm sure he doesn't want me doing an enema on him, so we'll just pretend like we're talking about a person. So this is the saline solution enema. So all you'll do is remove the cap. This is pre-lubricated tube, so you don't have to worry about lubrication. You'll insert the tip into the rectum with a slight side-to-side movement, and then you'll want to point the tip toward the umbilicus. You don't want to force the tip in because it could cause injury to the patient. And if they complain of pain, just stop and try asking the patient to take deep breaths and then inserting a small amount of fluid. Oftentimes this relaxes the sphincter or softens the stool enough so that the tip can be inserted. And then you'll squeeze the bottle, releasing most of the fluid into the rectum. And it's not necessary to release all the fluid because it usually contains more fluid than is needed. And then we also have this cleansing enema set. I have all the packages out here. So it has this 1500 enema bag. It has the clamp right here. It has the chucks, and then it has a soap enema packet. And so you would open the top and then insert your solution, which would probably be normal saline, and then your soap, and then close the top. You would hang it on an IV pole, and then you could prime the tubing, making sure the liquid would go down. Before you put the liquid in, make sure you slide this into the off position because you don't want it coming out before it's ready. Then you would just remove the cap and insert this end into the rectum slowly for about 10 centimeters in most adults. And then while holding the tubing, you would slide the clamp to the on position, and then you would just hold this like this and then insert slowly. You don't want to go too fast. You don't have to use all of the fluid because typical patients only need 750 to 1,000 for a large volume, and then oftentimes age plays a huge role here, so you wouldn't give your 54 kilogram elderly lady the same as you would a 90 kilogram man. Usually they're prescribed a certain amount of fluid though. If the patient complains of pain, just slow the flow or clamp the tubing for about 30 seconds and then just try again. You'll expel the contents, and then you'll place the clamp back on hold into the off position and then assess for any bleeding. Then you'll dispose of the excess bag and fluid. You may need to clean the patient some. Just make sure to inform the patient to retain the enema until the urge to evacuate is very strong, so usually between 1 to 5 minutes. You never want to leave an enema in longer than 10 minutes. It could be very bad. If the patient wants privacy, just hand them the call out and say, as soon as you need me, please let me know, but just be aware of the time. You don't want to leave them over 10 minutes or even close to that. You just want to be sure to be there to check on them. So that's basically how to do the enema. So if you all have any questions, just let me know.